Okay. Can you?
Hello, my name is Dongwoo Nam. I'm from South Korea, and today I'll be speaking about thread embedding therapy for pain relief and functional recovery and musculoskeletal disorders. I'm a professor at Kyunghee University, and I'm specialized for acupuncture and moxibustion, and I'm a director of international affairs at the Society of Korean Medicine and vice president of Korean Society of Acupuncture and Moxibustion, and also director at ICMART. I had a lot of chances to introduce Korean medicine on the Korean media. Well, today I will be introducing to you one of the new acupuncture methods used in Korea. As you can see here, acupuncture has evolved into various new forms. For example, we have the laser acupuncture, which is applicable for people who are afraid of needles, or the children or elderly patients. And also we have thicker acupuncture needles we call acupunctomy. So this is like a surgical mask. There are needles for bloodletting. Also, we use the sonography for guiding the acupuncture needles to the specific target we want to put the pharmacopuncture injections. These are the pharmacopuncture injections where we inject herbal extracts into acupuncture points. And this is the thread embedding therapy that I'll be introducing to you today. So what is embedding? It is a type of acupuncture where surgical threads or suture threads are inserted into acupuncture points, muscles, or tender points in order to enhance the acupuncture stimulation for a longer time. Well, the thread acts as a stimuli while it is absorbed over a certain amount of time. It usually
We lost the voice.
Yes. And after 48 weeks, none of the thread was observed. So you can see that the threads are maintained for 3 to 6 months, and the effects last for 6 months to 1 year, and then it is totally absorbed. You can see that we have various lengths and various thicknesses for the thread embedding therapy. We also have various thread types. You can see the monotype is the most typical one, the normal suture threads, and we could use it as a screw type. So if it's made into a screw shape, it will be more helpful to remain in one place inside the body. Also, we have the Cox type, where we'll cling into the soft tissues inside the body. So the effect of embedding therapy is to regenerate the collagen fibers. And also there are effects of neovascularization, and also it enhances the metabolism of the body and reduction of the fatty tissues. But for me, I would use it mainly for non-elastic or loose muscles or degenerative changes in the muscles. And when we insert the thread embedding therapy into these areas, the elasticness of the muscles will be recovered and the muscle will be more strengthened. So it can be used for low back pain, shoulder pain, cervical pain, and also knee pain and all sorts of chronic pain. Well, the effect is made by the three aspects. The stimulation by the needle itself. So when the needle penetrates the skin, it will stimulate the acupuncture point or also the skin. And there will be the physical stimulation of the thread. The thread left inside the body will keep on acting as a stimuli for 3 or 6 months. And also there will be a chemical stimulation of the thread. We could wet the surgical thread with certain medications or certain injections, but also the thread itself, while it is being hydrosis, it will act as a chemical stimulation. And we have historical records of embedding therapy up to the 1982. So you could find traditional literature stating these treatment about thread embedding therapy. But at this time, it was not the surgical threads, but they used catgut therapy and also golden acupuncture or gold threads. So these had its own side effects and also a lot of dangers. So it changed into more safe suture threads. You can see that studies on thread embedding therapy has been increasing in the recent years. The most common use for thread embedding therapy used to be cosmetic uses for wrinkles and to lift up your skin and so on. But nowadays, we use it a lot for musculoskeletal diseases and chronic pain disorders. And it can be used to strengthen ligaments, tendons, and also to stimulate the recovery of soft tissues. It can also be used for neurological or postural conditions, obesity, and gynecology, urogenital conditions, and all sorts of functional and internal medicine related disorders. You can see on the Chinese database that they have been publishing studies, articles on thread embedding therapy from the 1959. But the number of the studies have been increasing after the 1980s. So you can see that the number has significantly increased in the recent years about reporting the effects of thread embedding therapy. As for Korea, the first article reported was published in 2003, and the numbers have increased from 2008. You can see that there were many reports on musculoskeletal diseases. So thread embedding therapy was used for recovering injury of ankle ligaments, injury of cervical ligaments, recurrent dislocation of the patella, shoulder joint pain, or treating plantar fasciitis. And also it is used for HMP of L-spine. You can see that thread embedding therapy has been reported very effective for chronic low back pain. So it can be strengthening the erector muscles or also contouring the chronic pain. Here we can see some studies reporting the effectiveness of thread embedding therapy. So one study compared thread embedding therapy with physical therapy on chronic low back pain patients. And you can see that thread embedding therapy significantly improved pain and ODI indexes compared to the physical therapy control group. And another study also applied thread embedding therapy on chronic low back pain patients, and it was compared with a normal acupuncture treatment. It showed that the total effect rate and the recurrent rate and pain were all better in the thread embedding therapy group. not only for low back pain, but also there are meta-analysis or systematic reviews showing the effects of embedding therapies for various diseases. And this is one example where embedding therapy was applied for intractable facial paralysis. When we treat this disorders of the vertebra, we try to lose the weight bearing on the intervertebral disc, and also we try to modify the structure of the vertebrae, and also we try to recover the elasticness of the ligaments, and finally we try to strengthen the muscles. So we could use thread embedding therapy for these targets. Here is an example on where we apply the thread embedding therapy. These are the points to strengthen each muscles. For example, the area in number 1, we insert the thread embedding therapy perpendicularly to the spine to strengthen the intrinsic muscles. Number 3, you can see that we're inserting the thread embedding therapy to the muscle fibers to strengthen the lumbar erector muscles. And you can see that we're trying to strengthen other ligaments and other muscles by using thread embedding therapy. This is an example of how we apply the thread embedding therapy to the patients. So you can see that the needles are inserted perpendicularly to the spines. And after we remove the needles, the surgical threads are still left inside the body, and the stimulation goes on. And we could use longer needles in order to strengthen the erector muscles of the spine. And if we spin those needles, it's more easier to leave the threads inside the body. We're applying additional needles to strengthen the erector muscles. See that he is palpitating the targeted point with his left hand and inserting the needles towards that target. And not only do we target the muscles or ligaments, we also target certain acupuncture points. So acupuncture points that are effective for treating chronic low back pain, we can insert the thread embedding therapy so that the stimulation remains for a longer time. Also, recently I did a clinical trial to show that thread embedding therapy combined with acupuncture is effective for treating chronic low back pain patients. So we compared thread embedding therapy combined with acupuncture to acupuncture alone treatment. We recruited 38 subjects and 4 hospitals participated in the clinical trial. The Gyeonggi University Korean Medical Center, the Gangdong Gyeonggi University, and Dongguk University Korean Medical Center, and Daegu Korean Medical University all participated in recruiting the patients. And these are the treatment regimens we used during the clinical trial. So we tried to stimulate the multifidus muscles and the spinal erector muscles and the lumbar quadrate muscles with the thread embedding therapy. And we used acupuncture treatments on local points and distal points that are reported to be effective for treating chronic low back pain. As for the acupuncture alone control group, the same acupuncture points as the treatment group was applied. And the conclusions show that the thread embedding therapy was more effective in pain control compared to acupuncture alone. And also, functional disability and quality of life show significant improvement after treatment. I will show you another example of application of thread embedding therapy. So this is for cervical pain and shoulder disorder patients. The needles can be removed instantly after insertion, but also it can be retained like normal acupuncture for 15 to 20 minutes. This is another example how we apply thread embedding therapy to the knee. And also, thread embedding therapy is very popular for cosmetic uses. This is an example of treating patients. You can see the effects of the thread embedding therapy before and after the treatments. This is another example. I hope the lecture helped you get a little understanding of what thread embedding therapy is and how it is being applied in Korea. Thank you.